Neuroplasticity and stroke. There is no phenomenon that brings change to the brain's structure and function faster than a stroke. A stroke is the sudden cessation of blood flow to a specific region of the brain. It manifests as an abrupt, unexpected loss of our ability to move, communicate, and or interact with the world around us. A stroke changes the reality of one's life in a split second. We experience the world drastically differently. Our view of our own life is altered, and our body betrays us. In a sudden disabling attack, we are no longer who we thought we were. A stroke negatively influences our minds, our brains, and bodies all at once. It does so by causing neurons to die and the networks that they've created to perish, resulting in irreversible neurological damage. Neuronal networks are irreversibly damaged when they don't receive enough blood flow from the vessels that supply them. The arteries that supply the different regions of the brain are tubes of blood carrying high concentrations of the oxygen and nutrients that neurons need to live. To obstruct this flow or decrease the amount of blood that bathes the brain negatively influences neuronal integrity and function. The severity of the obstruction and the length of time that it persists dictates the extent of the damage. The death of neurons occurs quickly in response to this disruption of blood flow. After just a few minutes of being deprived of nutrients, the structure of the neuronal bodies in that region change. Millions of nerve cells at the core of the stroke begin to swell, rupturing their membranes, spilling their inner contents into the surrounding brain tissue. The resulting inflammation irritates neighboring neurons and puts pressure on nearby structures. Neurons in the areas surrounding the center of the stroke shrink in size, distorting their structure. Those neurons have yet to die, but they do become functionally impaired. As millions of neurons at the heart of a stroke die, billions of dendrites and synapses perish, destroying countless networks and damaging the entire brain network system. When strokes are assessed on CT scans or MRIs, we see them as isolated areas of brain damage. Those images, which show the localized regions of the brain the stroke has affected, as well as the networks of neurons that inhabit them, provide some factors on which a person's prognosis is based. The expectation is that the stroke victim's deficits will correlate with the function that we know that part of the brain is responsible for. However, neuronal networks are not confined to any particular area. They are widely distributed. Therefore, if someone has a stroke in an area of the brain responsible for their movement of their left leg, they may also experience other deficits. Neuroplasticity and stroke. Illustration showing how the network of neurons, axons, and dendrites are damaged during a stroke. As a clot blocks the flow of blood to a specific area of the brain, damage to one area indirectly affects the entire network. Imagine the entire brain as a huge, complex network of billions of neurons and trillions of connections, firing countless electrical impulses in every direction of the grid. Every function that the brain is responsible for is either directly or indirectly linked to each other. Therefore, a stroke that weakens any aspect of the link will hinder the networks of many brain functions. A stroke can be a devastating event in the life of a loved one or in our own lives. But neuroplasticity provides some hope here. Even when strokes destroy and damage neuronal networks, we can use neuroplasticity to birth new neurons, rebuild lost connections, and reorganize surviving networks and synapses. Our brains are capable of a tremendous amount of healing, particularly through conscious effort. The brain is wiring and rewiring at every opportunity. Often, when a person is left disabled by a stroke, they compensate by primarily using their stronger parts and ignoring their disability. That is, using a right arm if their left arm has been disabled. However, failing to use the weakened or paralyzed body part teaches the brain that it no longer needs to invest in a neuronal network for that function. The remaining neurons and synapses that would have compensated for those cells lost begin to deteriorate. To regain function after a stroke, people need to consciously and continuously work on what they've lost. It can be a difficult process, but doing so will prompt nerve cells neighboring the stroke to sprout new dendrites into the damaged part of the brain and can recoup some of the lost functions. Neurogenesis and synaptogenesis take place, helping to rebuild the damaged network and retrieve what was lost. Reteaching the brain what used to come so easy and learning new tasks can, of course, feel cumbersome and even frustrating. However, it's incredibly important because it helps to rewire the entire whole brain network system, remodeling the brain and helping people reclaim their lives. Neuroplasticity and epilepsy. There is no other neurological event that exemplifies the malfunction of neural networks or circuits more explicitly than a seizure. In normal brain function, neurons communicate with each other through the spread of chemical transmitters, which creates an electric current. A seizure occurs when the current becomes faulty. This results in a burst of electrical activity in the brain, similar to a short circuit. As a result, when a seizure occurs, at times without warning, we can lose control of our brains, our consciousness, and our bodies. A seizure negatively influences the brain by locking neurons in an electrical storm, hijacking our neural networks and our lives. The excessive neuronal electrical activity that results in a seizure causes a transient, episodic event that changes our behavior, alters the way we perceive our environment, and can even eliminate our ability to control our movements. Epilepsy is defined as having recurrent, unprovoked seizures or having an increased risk of having periodic events. Simply, we can divide epilepsy into two big categories: those with seizures that originate from one particular part of the brain or focus are diagnosed with focal epilepsy. People whose seizures are due to a burst of electrical activity involving the entire brain from the very beginning of the episode are diagnosed with generalized epilepsy. A seizure can occur as a result of many things. It is a symptom of something negatively influencing nerve cells, their connections, and the networks they associate with. When the structure of the brain has been warped by a tumor, damaged by a stroke, or trauma, or irritated by a bleed within the brain, the risk of a seizure increases. When neurons' function has been impaired by toxins such as alcohol or drugs, poisoned by wastes that a dysfunctional liver or kidney is unable to excrete, or affected by altered levels of electrolytes, a seizure is more likely to occur. In this way, a seizure is an expression of malady and injury to the neurons. It is their cry for help. As a result, any chance of healing must take a look at relieving the offending cause. A seizure is not just the result of an assault on our neural networks. Recurrent seizures also have a negative impact on the wiring within our brains, priming the brain to continue to short circuit. While we may not be able to predict how seizures spread across neural networks, we know that they do. And we know that this in turn increases the potential that other areas of the brain will become a focus from which seizures may originate. A seizure beginning in one area of the brain affects millions of neurons at the onset and involves countless more as the seizure spreads across different regions. Envision the brain's huge, complex network of billions of neurons and trillions of connections, firing countless electrical impulses in every direction. Now imagine the impact on the brain's entire neural network when these millions of neurons, their axons, and dendrites are suddenly seized by a surge of electrical activity. Every function in which those neurons play a role, directly or indirectly, and every individual network that they associate with, are impaired by the seizure. Once seizures become chronic, it is more difficult to treat epilepsy. Neuronal networks strengthen in chronic conditions. Misfiring neurons have more frequent bursts of electrical activity in patients with medically refractory epilepsy, and poorly functioning neurons deteriorate over time. In fact, recurrent seizures not only affect the composition and function of nerve cells, they also cause structural changes in the brain. In some people with uncontrolled epilepsy, parts of the brain undergo atrophy. That is, they begin shrinking due to this repeated excessive stimulation. These seizure-induced neuroplastic changes increase epilepsy's progressive nature in some people. Seizure-induced neuroplasticity doesn't just shrink the brain. It can also add to the existing neural networks. New nerve cells can be created after a seizure. These new neurons migrate to the areas of neuronal injury after a seizure occurs and integrate themselves into the neural network. Sometimes these immature nerve cells connect to the network or migrate to the wrong areas of the brain, possibly aggravating the seizure disorder. However, this same process underlines the amazing potential of neuroplasticity to heal the brains of people with epilepsy. If we could promote neurogenesis and support the migration of mature neurons to the areas within the brain prone to abnormal bursts of electrical activity, then we could encourage healing to take place at both the microscopic and gross structural level. We could stimulate neurogenesis and synaptogenesis to rebuild the damaged network, helping to repair what is injured and regain control of our brains, our bodies, and our lives. Neuroplasticity and Parkinson's disease. Famous actor Michael J. Fox said of living with Parkinson's disease, "With Parkinson's, it's like you're living in the middle of the street and you're stuck there in cement shoes and you know a bus is coming at you. And of course, there's nothing you can do. But with neuroplasticity, is there? Parkinson's disease is an illness that commandeers a person's mind and movement, leaving them cognitively impaired, stiff, slow, tremulous, and frozen in a state of unbridled neurological deterioration. It is caused by the degeneration of the brain. Specifically, Parkinson's disease occurs as a result of the degradation and death of neurons, especially in the part of the neuroverse called the substantia nigra, an area in the middle of the brain stained black because of its richness in the pigment melanin. The substantia nigra is made up of neurons which contain the chemical dopamine. Dopamine is a necessary component for normal movement. It is a positive neuroinfluence on the parts of the brain that play a central role in our motor control. Figure 4, Neuroplasticity and Parkinson's disease. Illustration depicting a healthy neuron receiving an adequate amount of dopamine, and below that a neuron in Parkinson's disease being deprived of adequate amounts of dopamine. The substantia nigra is a structure in the midbrain, stained dark by the neuromelanin found in dopamine-rich neurons. Death of neurons in the substantia nigra is associated with Parkinson's disease. To date, the main treatments for Parkinson's disease have been to boost the amount of dopamine in the brain and ease the deficits that result due to a lack of dopaminergic neurons. Dopamine is a neurotransmitter that affects many aspects of our lives. It is a chemical that gets released from neurons to influence other nerve cells, modulating our executive functions in the frontal lobe and influencing our mental state. It alters the white matter fibers that control our movements, impacts the hormones released by the pituitary gland, and controls the reinforcement and reward system that drives our motivations, and therefore our behaviors. Compared to other chemicals in the neuroverse, our brains don't make a lot of dopamine, but this chemical's influence is widespread and powerful. To lose some of the dopaminergic neurons can have a devastating impact, resulting in the symptoms associated with Parkinson's disease, especially impairments in movement. Our brains develop so that we can move, explore our environment, travel to new domains, have fresh experiences, learn, and evolve. Because it is a neurodegenerative disorder that impairs movement, Parkinson's disease is a negative neural influence on our entire brain. As people with Parkinson's become less mobile, they learn less and take in less new information. The neuroplastic brain has less opportunities to create new neurons, build new networks, and reinforce old connections in the immobile person. As a result, nerve cells wither, the neural network begins to break down, and the brain atrophies. The resulting cerebral atrophy seen with Parkinson's disease is likely the result of a few factors: the lack of dopamine nourishing the brain pathways it influences, and the lack of stimulation that occurs with immobility. People with Parkinson's disease develop impairments in thinking, memory, attention, concentration, and perception at higher rates than those without Parkinson's. These cognitive deficits can lead to dementia, making Parkinson's the second most common neurodegenerative disorder behind Alzheimer's disease. If Parkinson's disease is the result of the loss of neurons that specialize in secreting the neurotransmitter dopamine, then our neuroplastic brain's potential to create new neurons can be an ally in managing Parkinson's. Our brains have the remarkable potential to learn, create, wire, and rewire the neural network. People whose mobility have been restricted by a neurological disorder, such as Parkinson's disease, tend to do the same thing that stroke victims do. That is, they'll often avoid the area with which they struggle, which is what needs the most attention. Failing to work on the movements that have been impaired by the loss of dopamine causes further damage to our neural networks. By being conscious of our bodies and training the brain to move them in ways that may offset the deficits, we can stimulate the birth of new neurons and create new pathways through which nerve cells can communicate. In fact, the growth of the neural network not only occurs through the entire brain, but in areas primarily affected by Parkinson's disease. Engaging in behaviors that protect against losing dopaminergic neurons and that promote neurogenesis and synaptogenesis can help slow disease progression and improve the quality of our lives. Neuroplasticity and multiple sclerosis. There are a number of offenses that can injure our neuronal networks by attacking nerve cells and the trillions of connections that exist within the neuroverse. In addition to some scenarios we've already covered, such as strokes, seizures, and neurodegenerative disease, these assaults on our brains can occur with the abnormal growth of cells seen with a tumor, or a traumatic head injury whose impact wave rips axons and dendrites from their neurons, tearing the network apart. However, with multiple sclerosis, MS, the human's body's very own immune system attacks the gray matter, neurons, and white matter, axons, damaging our brains and leading to significant neurological disability. Multiple sclerosis occurs when, instead of protecting the body against foreign invaders, our immune system's cells attack myelin, the sheath of fat that wraps around the axons of our neurons. Myelin insulates the projections of our nerve cells, increasing the speed that the electrical signal travels from one neuron to the next. The result of this attack on myelin is that the wave of electrical energy across neurons slows, disrupting the ability of parts of our neuroverse to communicate and causing significant neurological impairment. Our immune system can attack myelin anywhere in the brain and spinal cord, resulting in a whole host of potential symptoms. With repeated attacks, the myelin sheath and the axon below it becomes irreversibly damaged and scarred, and permanent neurological deficits take hold. Multiple sclerosis also destroys oligodendrocytes, the cells responsible for creating and maintaining myelin. As the disease progresses, extensive demyelination of various regions of the central nervous system occurs. Axons begin to break down, neurons are unable to communicate efficiently, if at all, and a propagation of symptoms that vary based on the regions of the brain and spinal cord affected takes hold. People can suffer the pangs of losing the strength in their muscle while watching their bodies atrophy. They can develop numbness and tingling in their extremities, develop a painful loss of vision, and lose control of their bowels and bladder. The disease can rob people of their ability to express themselves and or their ability to explore the world around them without the help of a gait aid. The symptoms of multiple sclerosis are not just the results of demyelination. The other negative neuroinfluence at play in this disease process is inflammation. The attack on myelin by the immune system triggers a release of inflammatory cells that can do more damage to neurons, their axons, dendrites, and synapses. The corresponding swelling which occurs can potentially decrease the flow of electric current between nerve cells. Inflammatory cells may further promote demyelination and trigger the loss of axons and neurons, further disrupting the neuronal circuit. Multiple sclerosis damages the neuroplastic brain by causing myelin sheaths to fail, damaging axons, and forming scar tissue. It impairs neurons' ability to communicate by altering their ability to fire electrical impulses efficiently. MS does not just affect the areas blemished by a scar or flooded by inflammatory cells. It hinders the entire brain's neural circuit. The damaged nerve cells underneath the scar negatively impact on all the neurons to which they're connected. Therefore, to treat multiple sclerosis, those afflicted must take care to heal the entire neuronal network, modifying and correcting how neurons fire. Healing a brain impaired by MS starts by repealing the demyelination and inflammation injuring neurons and their connections. Removing these offending processes helps to restore balance to the brain, decreasing the abnormal firing of neurons. Taking away the pressures that stress the neural network can help to alleviate MS symptoms. Once demyelination and inflammation are relieved, it's paramount to make lifestyle modifications that promote neurogenesis and synaptogenesis, creating new neurons, forming new axons insulated by myelin, and growing new connections can increase the efficiency and strength of electrical impulses traveling between nerve cells. Rewiring the neural network can allow those afflicted with multiple sclerosis to lead better lives. Neuroplasticity and anxiety. Most people have felt anxiety at some point in their lives. It's a normal, everyday occurrence that can be triggered by public speaking or taking a plane ride. Anxiety is a physiological response that occurs when we are faced with a danger that threatens our lives, when we perceive possible danger, or even when we are uncertain of the outcome of something important to us. Anxiety involves feelings of nervousness, worry, uneasiness, and at times intense fear. It encompasses elevations in our heart rates, taking short, quick breaths that are difficult to control, profusely sweating, chest pains, and even the sense of impending doom. We've all experienced anxiety because it is part of our normal response to stress that originates in our brains which directly influences other aspects of our bodies. The hypothalamus, located on the underside of the frontal aspect of the brain, is charged with managing our response to stress by influencing the release of certain hormones. Its connection to the pituitary, a pea-sized gland at the base of the brain, and the adrenal glands, which sit on top of our kidneys, plays a role in managing our anxiety. A baseline amount of anxiety is normal. It helps focus our attention and determine whether we need to meet our threat head on, or flee for safety. Anxiety only becomes a disorder when the hypothalamic pituitary adrenal network becomes hyperexcitable. This can throw us into a state of excessive worry and nervousness, despite the fact that no threat is present. As a result, we begin to respond to normal situations as if they were threatening, worrying ourselves to the point where we cannot function normally. The hypothalamus is part of a network of neurons constituting the limbic system, which plays an important role in emotion and memory. People with anxiety disorders feel fear due to the memory of danger, whether that memory is true or the misinterpretation of a previous experience. Once that fear memory has been wired in, it is reinforced with every bout of anxiety. Like all other parts of the brain, the hypothalamus is plastic, capable of change both in structure and function. Emotions, such as anxiety, are powerful promoters of neuroplasticity. The more we focus on our anxieties and respond in an anxious way, the worse our state of uneasiness and apprehension gets. The more sensitive the hypothalamic pituitary adrenal network becomes, strengthening the circuit of fear that handicaps us. By constantly thinking of those things which make us nervous, the more deeply we ingrain the circuit of anxiety. The treatment of anxiety disorders is intimately tied to the use of medications that manipulate neurochemicals or minimize the physical symptoms produced by an anxious state, such as increased heart rate, elevated blood pressures, chest pain, or shortness of breath. These medications attempt to stabilize physiological responses to stress so that we don't overreact to everyday situations. However, they often don't eliminate the underlying problem, and they certainly don't alter the circuit of anxiety in a way that normalizes the function of our stress response. The dysfunction of the neural circuits of anxiety are often learned. We learn to fear non-threatening things or react in an anxious way to everyday situations based on experiences we've had in our past. Which, with each anxious response, we make that anxious circuit even stronger. The first law of neuroplasticity is neurons that fire together wire together. In other words, the more we respond in a fearful way to a given situation, the stronger we insulate that neural circuit. The second law of neuroplasticity is neurons that fire apart wire apart. So repeatedly inhibiting the anxious response to a given situation can break the circuit and help relieve our anxiety. Healing the anxious brain means interrupting the connection between the worrying thoughts and the stress response. If we're able to keep the body calm when facing anxiety-provoking situations, our neural networks are less likely to be hyperexcitable and the brain is less likely to worry. Also, concentrating on something other than the worry when encountering circumstances that cause uneasiness can help grow new neuronal circuits. The new circuit will compete with the old dysfunctional one, thereby weakening it, promoting a healthier response to stress and improving the quality of our lives. Neuroplasticity and depression. Depression is a significant cause of disability and morbidity. resulting in tremendous suffering in the lives of many people. It can occur in isolation or in association with multiple medical, psychiatric, and neurological disorders, and can even mimic other diseases. In fact, depression can present with such debilitating impairments in memory, learning, perception, understanding, and the consolidation of information that its symptoms can fool doctors into thinking that their patients have dementia. The varied appearances of depression can make it difficult to recognize, difficult to diagnose, and therefore difficult to treat. The diverse symptoms that depression can cause are not arbitrary manifestations of a sad state of mind. Instead, they are signs of the structural and microscopic changes that take place in the brains of depressed individuals. Neuroimaging studies show that major depressive disorder is associated with decreased volume in areas of the brain crucial to memory, emotional stability, the ability to learn new information, motivation, decision-making capabilities, sleep, sex, eating, and the stress response. These changes in the hippocampus, the amygdala, the frontal lobe, the prefrontal cortex, the hypothalamus, and other regions of the brain are measurable and have been calculated to be as high as a 15% reduction in these areas. When altered, these interconnected structures form a circuit of depression, decreasing the brain's ability to react and adapt appropriately to various stressors. Whether mild or severe, depression is much more than just a feeling of sadness. It is an unshakable sense of hopelessness and helplessness that results in an indifferent approach to all aspects of life. Depression leads to a feeling of social disconnection, a detachment from society that's intimately connected to the breakdown of the neural circuitry that occurs in the depressed brain. The structural changes in the brain associated with depression are at least in part due to the release of chemicals that are a negative neural influence. Stress changes our brains. In particular, the release of the stress hormone cortisol over a long period of time or in high quantities kills neurons, especially in the hippocampus, which is the center of emotion, memory, and the autonomic nervous system. Cortisol binds to receptors in the hippocampus, helping us to create memories and learn new information. However, too much cortisol damages the network of nerve cells within the hippocampus. It causes axons and dendrites to break down, retract from neighboring neurons, and significantly changes the circuitry. Excess cortisol prevents neurogenesis and synaptogenesis from taking place. In addition to impairing areas of the brain like the hippocampus, it also prevents those regions from rewiring and healing themselves. Without the ability to heal itself, the depressed brain becomes locked in a state of gloom and despair. Its neural circuitry breaks down, neurons are unable to communicate with each other, and the brain loses its ability to adapt. The neural network is designed to allow neurons to share and transmit information through the release of neurochemicals across synapses. As a result of the physical changes that take place in the brain's microcircuitry, including the degradation of axons and dendrites, and the loss of neurons, these neurotransmitters are unable to exert their influence. Nerve cell connection, nerve cell growth, and the overall function of the neural network plays a significant role in depression. This is why, among all the antidepressant treatments, electroconvulsive therapy, or ECT, has the highest response rates and gives people with depression one of the best chances of recovery. ECT is a brain stimulation procedure in which electric currents are intentionally passed through the brain, triggering a seizure. ECT does much more than just shock the brain out of the darkness of depression back to the light. It goes beyond allowing a stuck network of nerve cells the opportunity to reset itself. Electroconvulsive therapy is a spark of creation. It boosts the release of brain-derived neurotropic factor, a neurotransmitter that plays a vital role in neuroplasticity and neurogenesis. Electroconvulsive therapy encourages the creation of new neurons and promotes the connection of nerve cells. It does this in the hippocampus, a significant player in the depression circuit, and in an area of the brain responsible for memory and emotions. Treating depression, whether through ECT, medication, and therapy, or a combination of these, prompts new pathways to form in the brain, undoing the aberrant circuits that lead to the sense of helpless resignation. Healing depression changes the brain's microcircuitry, which in turn relieves the physical effects of depression and improves how people feel about themselves. The goals of depression treatment are to achieve remission, return people to optimal levels of psychosocial functioning, prevent the relapse of depression, and minimize adverse effects from treatment. However, neuroimaging studies show that after treating an acute episode of depression, the decreased volume and activity of some of the brain regions in the depression circuit normalizes. Seeing depression as a problem in the neural circuitry allows one the ability to make the necessary changes to the brain to undo depression, allowing people to reconnect themselves and society and live more fulfilling and happier lives.